With the acronym SLD, we refer to the evolutional clinical condition of reading comprehension, writing, and mathematical calculations disorders, which tend to appear in elementary school. These disorders include a specific domain of ability and leave the general intellectual functioning untouched. One of the most relevant features of SLD is the comorbidity, that is to say, the coexistence in the same subject of more than one SLD or of other neuropsychological disorders. According to the Ministry for Education, University and Research, in 2016-2017 there have been 254,614 SLD certifications on a total population of 8,660,574, that on average corresponds to 2.9%. The more distinctive features of the disease are the lack of automation of learning processes, its genetic constitutional origin, its persistence, its chronic nature, its evolutional nature. SLD are commonly divided into dyslexia, dysorthography, dysgraphia, and dyscalculia. Dyslexia is characterized by slow deciphering of letters and uncertainty in the use of syllables. This lack of automation in reading often leads to a poor awareness of the meaning of words. Indeed, dyslexic people focus their attention on deciphering at the expense of meaning elaboration. Dysorthography is a writing disorder, in particular in its linguistic aspect. Those who suffer from this disorder do not respect conventional rules of Italian language. The most common errors made by students with SLD are phonological errors, lexical errors, and accent or double letters X errors. Dysgraphy is a motor skills disorder that causes a significant difficulty in writing letters and numbers. As a consequence, the student with this kind of SLD will have an undefined, disharmonic, and incongruous mark. Calligraphy is considered dysgraphic if it's illegible also for the person who produced it. Dyscalculia is a disorder that concerns numerical transcoding ability, so students with this disability have difficulty in reading and writing complex numbers, above all those made up of zero and many figures. Students with dyscalculia show a mental arithmetic speed significantly far from standards, and the lack of automation leads them to use fingers or dysfunctional strategies. But which are the risk factors associated to SLD? When we talk about risk factors, we refer to a specific condition that is statistically associated to a disease, and for this reason can influence or speed up its development. Among the risk factors with which SLD seems to have a positive association, we can find exposure to more than one general anesthesias after the childbirth and within the 4th year of life, language disorders, male sex, parents affected from alcoholism and drug problems, parents with SLD. Talking about SLD disorders, we can forget the PDP, compensatory tools, and dispensatory measures. The PDP is a contract between families, schools, and social health institutions, developed to organize a specific training program based on the potentialities of the student with SLD. In it, all supports and strategies that help the realization of the academic success of students with learning difficulties are defined. Compensatory tools are devices that support and sustain students with SLD, substituting them in those tasks that are difficult to face due to the lack of automation of some abilities like alphabet and characters tables, calculator, recording, voice synthesis. These tools play a strengthening role, and they are not the resolution of the disorders. They reduce the charge but do not increase competencies. Dispensatory measures are strategies that exempt students with SLD from the excessive burden of some activities or from those evaluations that would penalize them, like the use of dictionaries or less exercises during the exams. As for compensatory tools, also the appliance of dispensatory measures can lead to difficulties because it can negatively influence the self-confidence of the student. The teaching of languages to students with SLD represents a rising interest issue for linguistic research. For this reason, in 2010, the Venetian School of Linguistics gave birth to a group named DELL, Evolutionary Dyslexia and Learning of Languages, with the aim to create alternative intervention strategies. For educational accessibility, we mean a series of choices adopted by language teachers to support those students with language learning difficulties. Considering a language handbook, it's essential to analyze 3 cognitive processes that students must activate in order to enjoy material: recognition, elaboration, and application. Already in the first phase, students with SLD can find difficulties due to visuospatial limitations of their disorder. Indeed, the captivating design of many handbooks makes contents visually more complex, even though more inspiring. Another obstacle can be identified in the process of elaboration due to memory limits of SLD disorders. For example, if each section does not make clear its objective, it is likely that students with SLD find difficulties in focusing their attention on fundamental elements of that specific section. Finally, for what concerns the application, students with SLD can find many obstacles from the gradual approach to each exercise to the passage from one activity to the next. Considering these difficulties may be appropriate not only graphical adjustments, but also adjustments in the organization of contents and in the structure and typology of exercises. The various cases of identification in the last years have led to the creation of a cultural context of knowledge and acceptance of SLD disorders, thanks to a new consideration of this phenomena seen as academic difficulty that can be addressed with the introduction of a new teaching and new supporting tools. In spite of this, these initiatives seem to be isolated cases and with an experimental nature. From this perspective, it's important to underline the lack of coordination between the various initiatives to guarantee a step change in preventing, diagnosing, treating, and rehabilitating SLD disorders. Without any doubt, it's a process that needs radical cultural and practice changes, but this is a significant opportunity for the Italian school system to bring out differences as specialities more than diversities. This should be for our country the starting point to turn the tide heading towards an academic system more attentive and respectful, more participating and efficient, more comprehensive and compassionate.